Would you like a second opinion on your diagnosis? Please send your analysis and medical history to Visite at qs24.tv. And our Chief of Medicine, Miss Dr. Wiechel, will analyse them for free and anonymous in our new series, Visite. For more information, visit qs24.tv. Welcome back to the next episode of Visite. And I am very happy that you are back. Thank you very much for the questions I received. And I would like to answer a question today from a lady who is 53 years old and has been suffering from migraines and headaches since she was 18. She conspicuously describes that these migraines are always on the right side of the head. They come with nausea, pain, and sometimes vomiting. It always starts with pressure on the head and with a certain loss of appetite in the morning. It has been coming back every 6 to 8 weeks. She has 2 children. The migraines were significantly better in both pregnancies. That is an important piece of evidence. Before and after the pregnancies, she switched the contraceptive pill to the Mirena IUD. Later, at the beginning of 2019, this IUD was removed. Since then, migraines, or in this case menstruation, have come only rarely, so she's slowly entering menopause now. Back in school, she writes, she regularly had cystitis and abdominal pain. Well, migraines and headaches are topics that usually go together, but the causes can vary and are usually very different. And there is no way around recognising what is really the cause here. And the first thing I would plead for, with which these patients simply have to reconsider, have you always had digestive problems? So digestive problems in terms of a digestive disorder can be caused by food intolerance, which causes a late inflammatory reaction. So in any case, please really refrain from having gluten, cereal containing gluten, or gluten containing cereals as part of your diet. This is an important indicator for recognising inflammation in the bowel. And that at least eliminates the risk factor for increased cell membrane permeability in the mucous membrane. This gluten is one thing, and I would also significantly reduce the milk protein, so cow's milk and cow's milk products as well as sugar, and then maybe it's good for a start, because at least an inflammatory reaction caused by food can be relieved a little after 4 to 70 hours. But if the migraine is right-sided, then you must always think about the liver. The liver is on the right, so any excessive demands on the liver will also be expressed to you through appropriate symptoms. Now, the relief that takes place through the migraines, and in the past also through menstruation, which it also is a way of detoxification. The kidneys help to detoxify by drinking enough water. This is a self-contained system which helps each other, and nevertheless, the liver must have developed a certain weakness over the years and decades that it can't do its job properly. A migraine is always the topic when the liver-gallbladder meridian would become weaker. These are always very specific that pull up from the neck, and they have a destroying, pulsating, strong pain. So vomiting is typical as a relief. I can't eat anything now either, so the liver ensures that you don't put additional workload onto it. And we have, in the many, many years in the clinic I work, the liver in the first instance. So everything that I would like to achieve for a person later on, first of all, I have to make sure that the liver is doing well, because the liver is the dramatic key, or the dramatic turntable for metabolism. So when the liver doesn't have its functional capacity, then you will feel it on completely different levels, like having a headache or migraine every 6 weeks. The liver is too important in terms of detoxification and metabolism as part of the production of anticoagulants for blood clotting or for circulation. The liver stores iron and much, much, much more. And if since childhood that has always been your weak point, as far as I can see from these lines, the bowel was always a weak point. And if you lived with animals as a child, with cats, with dogs, or on a farm, whatever, if you have been carrying parasitic load for years and decades, you will have reduced liver performance. So what happens first parasitically in the bowel can fit wonderfully, wonderfully in your large bile duct, which is what we can see in the ultrasound. But there are also hundreds of thousands of small bile ducts here, which find their way into this large bile duct. And then the bile naturally runs into the small intestine via the large bile duct. You don't know what's going on there. And clinically, you can't see it all in the ultrasound. Clinically, you can't see it either in a stool sample if there is a parasitic load. I would be very surprised. You would have to provide stool samples for 3 consecutive days. I would advise that you investigate this question of a parasitic load, because this can actually trigger a lot of other things. There are roundworms, there are ropeworms, there are an infinite number of parasites that, of course, if they can implant themselves, also cause these things over and over again. By the way, our liver also has a say in the provision of hormones. This means that a weaker liver metabolism also slowly causes a disharmony in providing sufficient hormonal strength. And especially during pregnancy, we have a lot of progesterone. Progesterone holds the child. Progesterone is very important for the development of brain maturation. Progesterone is one of the most important hormones when menstruation should be initiated. And if you are 53, perhaps physiologically it is not yet intended that you are going into menopause, but if you are now in menopause, then I have to tell you another detox valve is closed. Menstruation also regulates and releases. Today, it is of the opinion that menstruation is actually no longer that important. Young girls are already given anti-contraceptives so that menstruation stops. I wonder why doctors do that. Because so many women, especially after the menopause, where menstruation is no longer there, illness shifts to another level. So what was perhaps not symptomatically visible before is now visible because the body is no longer able to regulate. And a strong menstruation means that the body is finding relief again and again, which is incredibly important. Now, I don't want to get you out of menopause when physiologically you may be slowly entering menopause now. But in the meantime, you have to take hormones again. These hormones are now discontinued, or the IUD. And if I were you, I would also look at the hormonal situation again. I always like to measure it. The active hormones in saliva, DHEA, progesterone, estradiol. And I would measure these things so that you can get an idea of whether you might have a progesterone deficiency, which of course can regulate menstruation. For a few more years. But then, on the other hand, it is also positive for treating these migraines. Migraines can also be an issue that the liver is overloaded. And again you will hear me say, make sure that you don't have a leaky gut syndrome. This is so permanently important that you always start change at the root, so that it changes somewhere else. And if you developed a leaky gut as a child, and back then we knew nothing about it, then of course you have parasitic load. Also bacterial load, toxic load. You expected a lot of your liver. People who come in to us at the clinic, regardless of the clinical picture, if you're in the clinic for 3, 4 or 6 weeks, you have the liver detox week at the beginning. Because I want these bile ducts, I want to clean these niches that the body may also use for itself. Parasites are free riders. Parasites will never show themselves to you. And they have all the mechanisms in place to stay protected from the immune system. And they can no longer be attacked by the immune system once they have reached a certain size. And that is so important in a liver detox week, so that you can get out of your everyday life away from your pressure. Maneuver yourself down nutritionally, reduce it. Protein, the body opens up and everything can flow. And of course with that it returns a bit of regulatory power. From my experience, I see such developments in the context of migraines and headaches, often incredibly strong. And I'm just grateful and know that patients who experience this for themselves, what changes are ready to repeat it. And at this point, I can't say that it is important every month or important every year. It will always show individually what was possible during this first liver detoxification. What may be needed more often in the beginning, and what may be needed only once a year in the future. But a symptom is just an indication. A symptom is never a disease, and a disease is never a condition. A disease is a process that the body actually wants to find again towards health. Because the migraines, of course, increase the possibility of compensation, and the system finally begins to relieve itself again. And as far as I'm concerned, you don't have to live with such a large and heavy burden either, because your compensation is just on the verge. And 6 to 8 weeks, we sometimes have patients in the clinic who have severe migraine attacks, twice a week. And there is no recipe for success to be pulled out of a drawer to say, you just have to do that. You just have to know that when knowing also about the causes, a very good therapy for the symptoms, a migraine attack, for example, through high doses of active vitamin B6, then through Q10. Q10 is the one stimulant for the energy production of the nerve cells as well. Basically, when our patients have migraines, we give them these things. Q10 should be 300 to 400 milligrams. Please note that a high-quality Q10 supplement comes at a price because it's very difficult to make. It is partly made from cow hearts, but the purification or cleaning effort is so big that a lot of companies offer Q10 preparations, but they are simply not of enough high quality in their clinical effect. Or ubiquinol can be used as well. The company MSE has very high quality preparations. This is very important even when you say it always starts with pressure on your head, loss of appetite. You know that is a liver sign too. At the moment when the body signals here, leave me alone, I can't do that either. And then it just adds up. You can support this very, very well with enemas. For every expected beginning migraine attack or headache symptomology, make coffee enemas immediately. And then you take an irrigator with 500 to 1,000 millilitres of water, add 3 to 5 tablespoons of coffee charcoal, the green coffee charcoal, manufactured by the Visite company, and insert it very quietly rectally. The coffee absorbs toxins incredibly well in the intestine. The coffee activates the peristalsis. Everything that goes in the right direction causes relief. The head becomes freer. And the coffee also goes through the mucous membrane and expels bile again. And if you do a liver cleanse, it is also about this aspect of clearing the bile ducts so that more bile juice is available again. Indigestion, constipation, is a bile or even digestive juice problem. You can continue to support the liver through so-called liver detox mornings. And on these mornings, you don't get up and have a cup of coffee first, you drink half a litre of water with lemon juice. Make fresh apple puree with dates in the morning. You can simply put it in the blender, stir the apples nicely, add the dates. Keep in mind that the liver does most of its job at night. And it wants to create the relief here. And it must also be able to get it started, and it must also be able to get rid of it. That's why these are very important things that you can do. And of course, with that move your intervals further apart, and with it, of course, the intensity of the migraine attacks. These are really processes that you have to undertake now. And you should also understand that by integrating the whole body in this therapy, of course, you remove more and more of this stress load. It goes without saying that I ask you to take care that every day, once or twice a day, you should be able to go to the toilet well and sufficiently. If this is not the case, then you have too little digestive power. Then it is more important than ever that the liver is relieved and detoxified, and sufficient bile acids are available again. Please also remember that the bile also wants to be stimulated. We hardly have any bitter substances in our diet, and bitter substances are, for example, wormwood. Fresh wormwood was now in the garden. Just make a wormwood tea or absinthium. Artichoke, dandelion. These are mother tinctures, for example, made by the company therapies. But there are also bitter substances in variations, as a small bitter powder, herbal powder. Just put it on the tongue, salivate a little. That stimulates, and with more and more digestive enzymatic activity and strength, the body can manage better. So for the course of its life processes, also its great responsibility and digestive work, Of course, it needs the right substrate. And if you don't grant it that, if these mechanisms are also burdened with parasites, what you may not even know, then you live with a burden and only have, at certain intervals, a signalling of a problem that now, with 53 years of age, has its chronicity and actually always had it since the age of 18. That you really have to take a look first to see what actually happened. Because a lot more has happened over the years. A life has happened, pregnancies have happened. You have 2 children. There was a professional development. It must have been stressful too. It is if you live in a city, then of course you are burdened with cadmium, with the exhaust fumes, with so many toxins in a city, and you especially need to know how good is my liver actually in its detoxification capacity. And when you understand that, you might understand why you can only drink 1 glass of red wine at a time and not a second one, because that doesn't suit you at all. But if you know your detox performance is very poor, then you will act much more consciously. Then you say, I can be overwhelmed. For example, every 5th brand of lipstick contains lead. We have over 400 drugs that contain aluminium. We have so many phthalates, so many plasticizers. All of this has to be handled by the liver. And a person who, like you, has always had a major weak point somewhere in this sector, receives a signal for relief over and over again via the migraine in some form. The body registers it very precisely where its burdens lie. But try to understand what you could do to help in this context. To reduce its process in some way. So it is very important to really look at the intestines, eliminate leaky gut syndrome. Please also have an intracellular analysis of how much magnesium and how much zinc and how much Q10 you have available. I dare to believe that you have an undersupply there. Magnesium 600 milligrams, citrate 900 milligrams to 1200 during a migraine attack relaxes the blood vessels. The oxygen has the chance again to get into the brain and can also significantly reduce this migraine attack. Always remember, the liver, muscles and of course the nerves also need a lot of magnesium. You don't really have to live with migraines. We just don't focus today on the things that trigger them. And the things that trigger them are not the cause either. They are just the straw that broke the camel's back. And just the fact that during pregnancy it was better, the anamnesis alone that leads you there, I believe, gives you enough information now to look at yourself in this regard. Question things. And of course, to bring them into the process of treatment. I've missed one more thing. Please also think about your teeth. The 3rd teeth are the teeth which are connected to the liver, gallbladder meridian and a so-called interference field. A dead tooth, for example, on this 3rd tooth would mean that the liver works with a different energetic force than all other organs. That can perhaps be completely sufficient for a process that is not demanded so much, and this person has no complaints at all. This only becomes a big problem when of course the burden on the liver increases, when it wants to focus on investing in more strength, and it is not there. And that is also very important. As a rule, one does not hold on to dead teeth, because dead teeth are simply catapults of bacteria. There are thioethers, mercaptans, emanating from a dead tooth, and which the body has to detoxify and phagocytize over again when the immune system is burdened with it. But what's much worse is that the meridian, the liver gallbladder meridian, is also weakened by that, and that is a decisive flow of energy for everything that is on this meridian, what wants to be taken care of in the physical arrangement. Well, I think it's good that the IUD is out, and I'm not so happy that the monthly bleeding has ceased. But maybe through these diagnostic things that I think are very, very possible now, you will have a good success. And I would really like to wish you from my heart that now at 53 or 54, you can end a big chapter in your life. But as the saying goes by Hans Kruppe, illness is a symptom of lost life. The body throttles the subject of wrong movement, for only slowed down life finds the way back, and it refuses all superficiality and forces life into the depths. That's a big sentence, but it shows that life, which has to be reinvented every day, which has to and want to create the prerequisites anew every day to remain healthy, that this life also wants to be protected. And we as doctors must be able to recognise what has happened in your body. I think that's our job. But you are the ones who have to take action. And we have to guide you as you have to guide your body. And you can't stress it, neither can you chase it, nor can you dictate that it please with the commitment that you show. Finally, no longer produces or provokes migraines. You can only guide your body. And I believe that guidance and trust that you put in it will slowly and quietly relieve you from the load that may be incredibly easier to endure at first, when the episodes are no longer so close to each other and their symptoms are no longer as intense. With this in mind, I wish you very, very much success, and I am very much looking forward to next Sunday. To you and all of you too, thank you. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.